Welcome to JRTV. Now we will demonstrate how to do pedal exercise. In those who stay more than 6 to 8 hours in offices, like professionals, lawyers, next doctors, and officers. So those who stay for a long time in offices, the pooling of blood will be geographic. So, for gravitational force, the blood will be pooled into lower limbs. So, the deoxygenated blood should be reback to lungs, and it should be purified in the alveolar tissue, and then again it has to be supplied to the lower limbs, thigh muscles, and calf muscles, and ankle joints, knee joints, and hip joints, and in osseolar level. So for this there will be one equipment, pedal exercise. The pedal exercise will have monitor. In that there will be time specification and number of steps counting, and there will be calories, even calories burning also, and there will be heartbeat also. So this footrest is like pebble type appearance. So we have to do with barefoot only, because if there is any if we do it on barefoot, there will be pressure points in the foot itself. So the cardiac pressure points, renal pressure points, and vision pressure points, and speech pressure points, and memory pressure points, and hepatic liver pressure points, and gastrointestinal system pressure points, and walking pressure points, and so many pressure points will rejuvenate by doing this pedal exercise aggressively. Daily 100 steps we have to enhance 200 steps. 300, third day 300 steps, fourth day 400 steps, fifth day 500 steps, because all of a sudden if you do 1000 steps means there will be muscle cramps, and syncopic conditions, and there will be dyspnea on exertion, and sometimes fatigue may occur. So slow and steady wins the race. So slowly you can increase your steps day by day, and continuously World Health Organization recommendations minimum daily 10,000 steps by walking, or by running, or by any pedal exercise like that World Health Organization recommended. So the lower limbs, because due to gravitational force, all liquids in our body will pool in the lower limbs in static sitting for long time, 6 to 8 hours, or sedentary jobs. So even drivers will drive long time. Even if we travel long duration in a flight also, there will be tingling and numbness in the lower limbs. If we do puja for half an hour also, there will be tingling and numbness in lower limbs. There will be cessation of blood circulation to calf muscles, and deep tissues, and thigh muscles also. So there will be tingling and numbness. The signs are the instability after doing puja. there will be instability in standing. So these problems will overcome by doing this pedal exercise aggressively. So every professional should do this pedal exercise 10 to 15 minutes every day, so that there will be any cholesterol deposits in deep veins. So deep there we can check deep vein thrombosis and plaque formation, or deep vein emboli, or deep vein thrombosis. So we have to utilize our these equipments to overcome these medical emergencies. So uh, um, the way of doing this pedal exercise will be, I will demonstrate in the session. So that we can do it in slowly and steadily, seeing straight, and so that the steps will be monitored, and the calories we can monitor, and the time we can monitor, and the heart rate also, heart rate and pulse rate also we can monitor in this digital screen. And the contraindication for this pedal exercise: cardiac patients, those patients who gone for bypass surgery and stunts, and open heart surgeries, and diabetic patients only walking is advisable for 1 to 2 hours in sun exposure area. So there will be profuse sweating, and all the waste salts and poisonous elements will excreted through urine and sweat. And those patients who gone for orthopedic treatment, means fractures and disseminated multiple fractures, like that we can't contraindicated for doing this pedal exercise. And psychic patients also, and a heavy personality, more than 100 kgs, it can't withstand, and hefty personalities also not advisable to do this exercise, because there will be instability in center of gravity, they may fall down. So there will be cerebrovascular emergencies, like cerebral hemorrhage, cerebral thrombosis, and cerebral emboli. So contraindication: diabetics, cardiac patients, and hefty personality, and children's, and psychic patients, and multiple those patients who gone for multiple fracture treatment. So orthopedic patients also not advisable. So this pedal exercise will definitely improve the blood circulation to lower limbs, like thigh muscles, and calf muscles, and femur and tibia, fibula, and ankle joint, and dorsum of the foot, and at the tissues at the toe level, and sole of the foot, and at the gluteal region, and hip joint, so that all the joints will be perfect, muscles will be hypertrophy, and very very tonicity, and action and reaction will be very spontaneous, and the person will have more of energy from morning to even evening time, and he will be more active, and very much creative, and very much the ideology also, ideas will be more creative, so that the lifespan of those who do this pedal exercise will be enhanced by 10 to 15 years definitely, without any clots or plaque formation or any deposits in deep veins in sciatic region, and deep vein thrombosis never occur in life in your life. So we have to do it aggressively by doing this pedal exercise, so that all athletes and sports people and lawn tennis sports girls and boys will do regularly, will do this exercise. The in patients, those who have a tendon tearing also not recommended for doing this HLS tendon tearing patients also not advisable to do this pedal exercise. So be cautious and do slowly and steadily, and you will get good hypertrophy, good personality, muscles without any fat deposits in gluteal region, thigh region, and lower limbs region, and at the calf muscle area. So do it professionally, and do it slowly and steadily. Definitely the personality of those who do this pedal exercise will increase, and the stamina also increase, and the energy levels also will increase. The walking style also definitely improve, and the tissue rejuvenation will improve, and at the capillary level also the circulation will be improved. There won't be future necrotic conditions. No question of gangrenous conditions, no question of dry gangrene or wet gangrene, and diabetes also we can overcome by doing this exercise in student level. So everybody should book in online in e-commerce site, so that it will be less than 3,000 rupees. So it will do your lifespan will be improved, and your life will be lifespan will be enhanced by 15 to 20 years by doing this exercise without any necrotic problems, and without any obstructions in flow of deep veins, deep vein thrombosis, and the heartbeat, and the kidneys, and the liver, and lungs, and the neurosensory cells in brain will very active, and in a very full oxygenated condition and rejuvenated condition. So utilize this pedal exercise and do it regularly, and you will be the very healthy workforce for our country, and you will be the icon for next generation to explore your inner thoughts, and creation of creativity in the future. So this pedal exercise will be advisable for ladies and gents and professionals, and police officers, lawyers, and judges, and those who sit, teachers, those who sit more than 1 hour in the chair, and more than 6 to 8 hours in offices must and should do this pedal exercise, so that there will be pressure points in the foot will initiate and activate and rejuvenate the centers in neurosensory organ in brain, so that all the organs will function in active mode and energetic mode, and there will be profuse bleeding in lower limbs, and there will be profuse oxygenated blood will pass into tissue levels. So the person's health will be more, and persons will be very healthy and without any nosocomial infections, hospital acquired infections, or say seasonal infections, or viral fevers, or bacterial infections like streptococcus and staphylococcus, and skin we can escape from skin diseases, because the sweat pores in the lower limbs and the hands will be open up, and there will be excretion, the salts will be excreted through sweat, and never get renal stones by doing this aggressive bulwarker exercise and pedal exercise, and even skipping also. So the organs will be, all the organs will be rejuvenated with full 100% oxygenated blood, and the organs life will be increased by definitely by a long time. Means the person, those who do daily exercise will live long time, more than 100 years or 105 years or 110 years by doing exercise. If you sit for long time, your life will gone. There will be cholesterol deposits in deep veins, because you are consuming, the Indian people are consuming more of edible oils in curries due to they want palatable taste for curries. They are using more of edible oils in the curries, and deep fries, and in snacks. In everything will be filled with oil food. So the oil will be converted into cholesterol balls in the deep veins, so that there will be obstruction in oxygenation of deoxygenated blood in the lower limbs. So there will be pooling of blood, and there will be clots, formation in deep veins in so many areas. So to overcome this clots and plaques and thrombus and emboli in lower deep veins, we have to do vigorous exercise, skipping, and this pedal exercise, and running, and treadmill exercise, and jumping, like that we have to do, so that there will be rejuvenation of binary and tertiary and quadri branches of arteries, and femoral arteries, and veins in deep tissue, so that all the micro tissue level there will be oxygenated blood will be supplied, and the person will be very active and energetic, and so much of muscular force in lower limbs. If we have muscular force in lower limbs, we will be more energetic for a long time. If we have if there is any clots in the lower limbs, the person will be very lazy, and he will sit for long time in chair and watching TV, and taking more of snacks. Beside, he will keep one vessel full of snacks beside him, and he will take more of food while watching TV. So there will be obesity problem. There will be fatty deposits in gluteal region. There will be fatty deposits in umbilical region, and there will be buffalo hump, and there will be excess of water accumulation in the body, distended abdomen, and there will be puffiness of face, and baggy eyelids due to renal insufficiency and nephrotic syndrome, due to there will be depletion of kidneys function by taking more of food, and more of hypercholesteremia and hypoglycemic conditions will be vulnerable, and the patient's lifespan will be decreased inevitably. So the exercise will improve the human life for a long time by doing this pedal exercise. So everybody should, every student, every professional should do this pedal exercise. Inevitably, those who sit for 6 hours to 8 hours in the office without any sedentary life, without any movement, like sedentary life or sedentary post or static post, like drivers and conductors also. So all professionals in doctors, engineers, and office professionals, software, hardware, and judges, those who sit for long time should do this exercise and improve their health for giving more service to the society. And you are the icons for next generation for doing this continuous, you are adopting to the next generation for doing this pedal exercise to improve your blood circulation to lower limbs, and to improve your deoxygenated blood will come to lungs, and it get oxygenated, and again it will supply to lower limbs in tissue levels and muscular levels, in osteo levels also. I am doing very aggressively, please watch it, but you people should do very slow and study, because I am doing this exercise since 3 decades. So my calf muscles are very healthy, and without any tingling and numbness in the lower limbs if I sit for more than 1 hour also. So the vital capacity of lungs also improved, the tissue regeneration, and at tissue levels in calf muscles and thigh muscles and ankle and hip joint, knee joint will be very, there will be improvement in synovial secretions also at synovial sac level. So the largest sesamoid bone in the human body is patella. So at the patella level also there will be synovial secretion, and there will be excess rejuvenation of blood circulation to joints and ankle and hip joint. So the person won't get fatigue or syncopic attacks or weakness or joint swellings also.